welcome the Australian Institute of Paramedic Practitioners webinar and podcast series. Buckle up for our next webinar with JD Heffern from Canada. Well, welcome JD. Thank you for joining me today for the Australian Institute of Paramedic Practitioners CPT webinars that we've been running this year. Without further ado, would you mind introducing yourself to the people here in Australia, those that haven't met you before, and give us a bit of a rundown of sort of how you ended up where you are today and sort of where you feel sort of the future of sort of community paramedicine and other aspects like that are going in Canada?
Wow, that's kind of a loaded introduction, Duncan.
Sorry about that. We can break it down into individual steps.
Yeah. But anyways, all I have to say is hello. My name is JD Heffern. My current role is I'm the Chief Paramedic Chief Executive with the Government of Canada within the Department of Indigenous Services Canada. And I've had this role for the last 6 years. And prior to that, I was in the County of Renfrew Paramedic Service on the senior leadership team, where my main focus was around community paramedicine and primary healthcare integration and alternative models of care for paramedic practice, which was amazing, and I loved it. And I've been very fortunate that even though that I've moved on to the federal government, I still maintain a position on that team as a casual commander with the County of Renfrew Paramedic Service, because I love being associated with people and organizations that are pushing the limits, are really striving for greater progression and innovation within paramedic practice. And within Canada, the County of Renfrew Paramedic Service has really exemplified that over the last 2 decades, essentially. So I've been a paramedic, I don't even know how many years. But it is my second career. I'll be honest, I was a late bloomer. My first career was, I kind of grew up in a family-ish oriented business, and I was one of those 13-year-old children sitting around a table with my father, who was a businessman, and talking about strategic planning and profit gain and profit loss, and how to deal with disgruntled employees and all of the rest of it. And I was really kind of thinking that that's where I would be ending up in the long term. And I kind of waffled around a little bit for a number of years. I was in, I got into outdoor and experiential education, and I was teaching a lot of youth that were at risk by leveraging things like rock climbing and ice climbing and canoeing and camping to facilitate, some life transformation pieces. And so I kind of waffled around in a bunch of things. I looked at medical school for a little while, and just realized that probably wasn't the right alignment for me. And because I've always loved things medical, and I love community. And I met this wonderful lady who's still an influence in my life, even though I don't talk to her very often, who used to be senior leader within one of our regional paramedic services in the Greater Toronto area.
Mm-hmm.
And I told her one night, I said, Kim, I think I want to be a paramedic. And she went crazy. She was super excited because she kept saying, we're in this amazing state where, change is about to happen. We're on the cusp of amazing change around locally service provision and nationally and internationally. But what we really need is we need leaders that have the proper education and experiences, that have not necessarily grown up in the system and occupy a seat of leadership now just because they've been there a long time,
Mm-hmm.
but because they're the actual right fit to make change happen. And that can be, very positive sort of disturbers of this historical system norms.
Mm-hmm.
And so I went to school to be a paramedic, and I became qualified and certified. And then I worked in a couple services outside of the Toronto area. And one of my the chief executive of one of the services I worked for and I were talking, and he said to me, I need you to meet somebody that I used to work with, that is a change maker and somebody that disturbs the status quo. And you guys are the same person. just you're a bit younger than him by a couple of years.
Hmm.
And so Andy, his name was Andy, set me up with a meeting with, and some of your audience may know or have heard or read of some of Chief Michael Nolan's publications and the work that he's done.
Hmm.
But Mike and I became friends, and kind of became like a bit of a mentor, a bit of a brother, and then eventually years later, I ended up working for him.
Yep.
And when I went to the county of Renfrew, I worked as a frontline paramedic because I really wanted to demonstrate my clinical skills and earn the credibility of my colleagues.
Hmm.
And I think that's important. And then I actually got involved on the labor side, which was really crazy because I'm not labor oriented or union oriented. But I was voted as president of our local union. And so now I was actually sitting across the table from this guy that was like a mentor and a brother to me, and making, I would argue, positive change and showing that the labor side of the labor relations side of what we do can actually work very well if the priorities are aligned with the operational side of service provision. And so, I take a lot of pride that Mike and I were able to do that. And it was challenging
Hmm.
because I was very transparent that Mike and I were friends. I didn't want people to think that we were like waking up in the morning and, you know, conniving about what we were going to do to, harm our paramedics' days or, these kind of things. Like there was no hidden agenda. I was there to represent the employees and the labor
Hmm.
side. Mike was there to represent the corporation or the county.
Hmm.
And we argued and we fought many times. But it was an amazing experience. And then from there, I went years later. I got involved on the management side with the county of Renfrew as an acting supervisor, and then became a full-time supervisor, and then 7 years ago, the government of Canada was looking at could community paramedics support primary healthcare in remote and isolated Indigenous communities. And so they were looking for somebody that had experience in community paramedicine and program development.
Hmm.
Somebody was a senior leader within paramedic service, and somebody that had experience within Indigenous contexts. So my wife and I, when we first got married 25 years ago, we literally, I put a blindfold on my wife. I gave her a dart. I put a map of Canada on the wall. I spun her in a circle. I said, throw the dart wherever it lands, we're going to move. And it landed on this community called Moosonee, which is in the James Bay coast, which is quite far away. And it's a remote, you can only access it by train or by flights. You can't drive there. And so we moved there for 4 years, or just almost 4 years.
Hmm.
And so I had some experience in Indigenous context and culture. And so I did a secondment with the federal government for a year initially, and then it became 2 years. And then they saw the value in paramedics supporting primary care and as part of the interdisciplinary healthcare team approach,
Hmm.
and created a chief executive position within the Department of Primary Care. And so that's what I've been doing for the last roughly 5.5, 6-ish years. And we've been doing a lot of pretty interesting and pretty cool things, all with the, and a lot of your listeners probably, with the Aboriginal communities and contexts that, are within Australia and New Zealand. A lot of what we do not for the people, but with the people in the
Yep.
spirit of truth,
100%.
in the spirit of truth and reconciliation.
Hmm.
Uh, and so it's been really interesting. But that's kind of like I guess it's not an elevator pitch because that was more than 2 minutes, but that's kind of who I am. There's lots of more pieces within that, but
Hmm.
kind of gives you a bit of a background of who I am and what I do.
I think you answered my question quite well to start with. So I think you gave me back more than I actually asked for. But with your response, which was quite amazing, let's delve back into the community paramedic area for a bit before we move into your current role within the federal government. What was it like because you really sort of came into that in that sort of pioneering stage in Canada. And yeah, I know Chief Nolan pretty well as well over the years through IRCP and some other connections when I've been over there. What was it like being part of that pioneering phase of sort of getting that off the ground to the point where it was recognised by federal government to say, hey, let's try this in remote communities? What was it like being part of that initial phase? And what were the key
Yeah,
things that made you guys succeed, or were there failures
yeah.
that you reflected back on and moved forward with?
Well, it's funny. Like if Duncan, if you go back and if you look at like project management 101, and
Hmm.
you look at, like how do you manage a project from, the beginning or the genesis
Yep.
to, implementation, to the reflective phase, or, we talk about the PDSA cycle, plan, do, study, act.
Yes.
We actually, when we started the program, we actually didn't do any of that. We just kind of threw a bunch of things at the wall
Mm.
and looked at what sticks. And at the end of the day, really what we were trying to do was provide an appropriate service to the community that was a gap,
Hmm.
and be really nice to people. And so be professional, be nice, and fill the gaps. And then build upon those successes. And so over the years, that's really how we did it. Now, obviously, now it's become much more formal. There's
Hmm.
much more QA and quality assurance and quality improvement pieces within it. But really, at the beginning, it was, instead of having paramedics sitting in their station or their bases waiting for 911 calls, how about you go out into the community and you just be nice to people, and you meet people at a child's football match or a soccer game, and you hand out vouchers for ice cream cones, or you check and make sure the sizing of the bicycle helmet that the young person is wearing is the right size, or
Hmm.
you just go out and do things, and then through that, it just naturally, through an organic progression, evolved, where now we are intimately tied into people's healthcare continuum and their
Hmm.
journey. We are the eyes, we are the ears, we are the hands
Hmm.
of their primary care teams, and we're very trusted by them, because not only now do they call us in those times of complete dire straits, or when there is an emergency, but they welcome us with open arms when we're there to be preventative and proactive, to keep them out of the A&E or the emergency departments,
Hmm.
and away from their physicians. Once we've developed that level of trust, it's pretty powerful. And now, like one of the story, or not stories, but one of the things, and actually you mentioned IRCP earlier with Chief Nolan, with Mike. So Mike and I sit on the advisory council for the International Roundtable on Community Paramedicine, and which will be in Adelaide in August, in a couple of weeks. And one of the presenters there, who as well, is Dr. Alan Batt,
Yes.
and
Yeah. It's great value.
not only is he incredibly intelligent, but he's actually very humorous as well. But one of the pieces that Alan is working on here in Canada, and we've been doing this as community paramedics for years, but
Hmm.
we've never labeled it. We've never labeled
Okay.
it, and we've been doing it, and doing it very successfully, but there's never been any tracking or labeling or formality put to it, and that is around social prescribing, right?
Yeah. Okay.
Like, so,
Yep.
like the whole concept of healthcare system navigation, or being a care coordinator for patients in the out of hospital environment, and being that preventative and proactive approach to individual patients' healthcare journeys, is social prescribing is a big piece. Sometimes people don't need a bandage or a plaster put on a wound. They just need a referral to, somebody to talk to, or something else. And
Mm.
and we've been doing that for years, because we're a trusted profession in our community and in the public. But we've never tracked it. We've never put any formal pieces together on it. So I guess, that's a really digression of an answer for you to what you've asked me. But really, at the genesis, or at the beginning of community paramedic programming, challenges, there was 100% challenges, because people would argue with us and say, well, your job is to drive, lights and sirens or blue lights to
Mm.
pick somebody up and take them to the hospital. That's what your core business is.
Mm.
And we started to argue and say, well, no, that's part of our business, but there's all these other things, and we've demonstrated it through the pandemic with our integration into public health.
Yep.
The 911 or the 999 or the 112, depending on what continent you live on, that business never going to go away. There's always going
It's
to be a
always going to
need for
be there. Yep.
it, right? But there's all kinds of other pieces that we as paramedics, and you and I both have used the example of the Swiss Army knife many times.
Many times, yeah. Or MacGyver,
right?
Picture of MacGyver,
Yeah,
yeah,
or
that's the other one.
MacGyver, yeah, right, yeah, exactly. And I hold fast to it because it is what we do and who we are, and our identity is we are completely the Swiss Army knife of the healthcare system, because we can work with our nursing colleagues and our respiratory therapy colleagues and our occupational therapy colleagues and our psychotherapists and our physicians and our, like we really are the grout between the tiles, if you will. And so,
Yep.
but it took a long time, and a lot of people way smarter than me to get us to where we are now. And I've just had a little piece of it in the work that I've done, and I'm just. And I'll be very clear, because I get asked this question, so I'll ask it to myself, because you may ask it later. But people quite often ask, why am I so passionate about community paramedicine and learning from other systems to bring back to where I live and develop programming in community paramedicine?
Mm-hmm.
And the truthful answer is, it's not because JD Heffern is a nice guy, because I'm not. I have an agenda. And my agenda is, I'm going to get old someday, and I'm going to need these services. So yeah, so I want to be an architect of the system and develop a system that's not, unicorns and rainbows, but it's real.
Yes.
And it meets the needs of myself and my family in the generations to come.
Yep.
And so, yes,
awesome.
am I a nice guy? I like to think I am. But really, my motivation is I see that we as paramedics can do so much more. And if I can help support a system being developed to meet my needs in the future, that's the selfish bit,
Yes.
which may not be selfish, but kind of sounds that way. Then I just want a system that is appropriate and will provide the appropriate care for me when I'm old.
Yeah, and there's nothing wrong with that at all. I mean, you hit the nail on the head at the start, where the sort of the genesis of community paramedicine doesn't matter where you look at it, be it UK, Australia, Canada, US, New Zealand, like they're filling in gaps that wasn't there. And yeah, I mean, I've been involved since 2005, and yeah, we were literally sort of making it up as we went. There wasn't any real sort of project plan compared to when you look at how programs evolve today or modernize today. There's definitely key areas that they now they look for the gaps, as opposed to throwing all of the gaps on the wall and seeing what works. So yeah,
Yep.
that's really that's really cool to sort of explain it that way. And even though you've sort of moved into some of those sort of executive roles and things over the years, I do believe you're a bit like me, where you like to go back on the road and keep your skills intact and other aspects like that. Like you have that drawback to doing that traditional sort of medicine approach and paramedic stuff that you grew up doing.
Yeah,
Yeah.
absolutely. And I think part of it too is, I remember I had an educator many years ago that was teaching, and he'd been teaching for so
Yes.
long that there was a bit of a disconnect there from reality.
Yep.
And I always said to myself, I don't want to ever be in a position where I have that disconnect. I don't need to know it all.
Yep.
But I do I do spend time on the road. And I do calls, and
Yep.
I go out and support my team, because I'm a big believer that I need to empower and resource my teams appropriately to be able to be successful. And my mantra has always been, as long as you're nice to people, and you're professional to people, and you're clinically sound and not do anything
Yes.
erroneous, then you'll be fine.
Yep.
And you'll serve the
Yeah.
community well. And so I definitely do a lot of that. I love the road. I do. Like, that's where I'm now at the point where I'm actually getting older, and I'm recalling certain stories of patient interactions that I've had, or I may be speaking at a conference and I'll tell a story about something, and I'm like, holy man, that was a long time ago. I need to go out and make some more. I need to go out and make some more stories. And so I do that regularly. Get out there,
Yeah.
and it's very important to me, like very important.
Yeah. Yeah, and I couldn't agree more. But yeah, you're right. Like tell a story, and it's like it was 10 years ago. I thought that was last week. Actually, no, that was like 2015. Wow, that went quick.
Yeah,
So
absolutely. Yeah.
if we fast forward now to your current role, which started initially as sort of let's see what it's like and let's renew it for a little bit, and then evolve from there. So how has that been for you, watching that sort of go from the initial, let's see what this looks like, to evolving to what you're sort of doing today? What's that journey look like for you?
Yeah, it's been amazing.
Hmm.
It's been very challenging, and challenging not for. So I think any government entity has its challenges,
Hmm.
because
100%.
there's so many policies and legislative requirements. I find that any level of government is pretty risk adverse to try new things without, all of the T's being crossed and the I's being
Hmm.
dotted, so to speak.
Hmm.
That's been my biggest challenge.
Yep.
I'm not a policy. I've had to become a policy person, um, out of necessity, because I'm dealing with the elected officials and like
Yep.
ministerial offices. Like since I've had this role, I think I've had 5 or 6 ministers, right? So you're constantly, and when you get
Starting back
the
again. You have to start back again.
yeah,
Yeah.
exactly. In order for them to understand or to justify certain things. So
Hmm.
so it's a lot of communication. Um, Came in and we had nothing.
Hmm.
So essentially something is better than nothing. And
Yep.
so we've been able to do more than just something, and a bunch of somethings, and been successful in that. And I always said that I would have a period of time that I would be in the role I'm in, and I still
Hmm.
kind of I still feel that way. But it's been a joy to see firsthand some of the work that was never ever there before, but now is being delivered. So, for example,
That's cool.
we have communities in the northern parts, so not unlike the Northern Territory down there,
Hmm.
that are incredibly remote and isolated. The only difference is we get lots of snow, and there's a lot of historical trauma associated with this due to
Hmm.
colonization and the role of colonialism, but also the role of certain organized religion and so on
Hmm.
and so forth. And there's a lot of pain in the history of Canada with these communities. And there are communities in Canada that, if you look at the World Health Organization, they have a criteria that contains 3 bullet points that indicate that they used to call it third world country traits, but now it's developed versus developing world country traits.
Hmm.
And economic instability and poverty and lack of access to healthcare and food, etc. So kind of like the social determinants of health. And we have communities in Canada, what I would argue is a first world, or what I guess I'm supposed to say is a developed country,
Hmm.
that have developing country traits. Non-potable water, not
Hmm.
secure access to food, not secure access to healthcare, let alone social or mental health or addictions healthcare. And so we've been able to now take paramedics and use their skill set and embed them in these communities, in very remote and rural settings, uh, to provide care. We have a community in northwestern Ontario. So I live, if you look at the picture of Canada, I live kind of in the middle to the right in the province of Ontario,
Hmm.
and I live in Ottawa, the city of Ottawa, which is the capital of Canada.
Yep.
But if you were to fly, well, actually, I'll give it to you in driving. If you were to drive about 30 hours, sort of north, not quite 30 hours, but northwest of where I live,
Hmm.
we have a community. We have a community there called Pikangikum,
Hmm.
and and it's a lovely, lovely community on a beautiful lake. In the winter time, when the lake freezes, you can drive in and drive out, but other than that, you have to fly in.
Okay.
And there's about 5,000 people that live. And of the 5,000 people, half of the population is under the age of 18.
Well, yeah, okay.
So when you look at it from a community needs assessment as a community paramedic, we think of community paramedicine dealing with like geriatrics or elder populations
Mm-hmm.
generally, right?
Yep.
Not that you're dealing with pediatric populations. And so, we've been able to work with the Independent First Nation Alliance and the paramedic service up there to be able to develop a pediatric medical assistance team that works in the school system, providing community paramedicine around social, mental health, homelessness, and substance abuse counseling with other healthcare providers, as well as guidance counselors in the schools. So never been done before in Canada.
That's cool.
But we've been able to facilitate and work with that and fund that and help that be developed, right? So that's where I take a lot of pride in what, not that I do, but the people I surround myself with do, to meet the community needs. And we do this all in the spirit of truth and reconciliation. We know that there's been incredibly terrible, despicable, unspeakable things that have been done to our Indigenous population in over the last couple hundred years. And will my work that we do fix it? No, we won't. But can we make it a little bit better? Can we kind of equal it out a little bit? Like right now we have a disparity between access to paramedic services in urban and rural settings versus remote and isolated Indigenous settings. As a good friend of mine who is Indigenous himself and is a paramedic leader in Canada, he always says to me, he says, JD, I don't want more. I just want the same. I just want to be able to have the same access to care that the non-Indigenous people have in other places.
Yep.
In a timely fashion. And I don't think that's a lot to ask.
And no, and if you break that down even further, it's like, well, what can we do that enhances that community so it would be the same level of access to care that they would get elsewhere? It's not looking for a handout, looking for the ability to go same. And yeah, I couldn't agree more. I mean, it's your heart bleeds and breaks when you walk into some of these areas. And I know you've got a fair bit of understanding what my PhD's been over the years. And when COVID hit, because I couldn't go overseas anymore, I actually did investigate to see whether or not I can convert it over to Indigenous communities here in Australia. And it blew me away, the exact example you gave, just how here we are in this big country that's meant to be classified as a high income, high healthcare, providing all this type of stuff. And some of the places I was visiting were less capable than the countries I was working in across Asia and other parts of the world, and I was mortified. So I did see a complete connection of how all the work I'd done over there could also be applied here locally as well, or in your case, Indigenous communities in Canada. And I remember one of the first times I went over to Canada and I was in one of the museums. I think it was the Saskatoon museum they've got near their entertainment centre there, and it did a big rundown on Indigenous history in Canada. And I was reading it going, it just sounds like Australia, but further north. Just everything 100%. They went through, everything they've gone through. There's just so many similarities, and it's sad, but I think I mean, one of the areas I've looked at too, and one of the other places I've worked at too, was looking at how we could enhance the healthcare within the communities themselves. Like many people, they don't want to leave the community, but what can you do to help them stay in the community, and how can you increase? I mean, nurses and doctors and paramedics are always going to fly in and fly out, but what else can you do at that local level? How else can you engage the elders and look at ways in which you can improve healthcare within that location? So that's that analogy of don't want more, we just want the same that's brilliant.
And I think
speaks volumes.
Yeah, and another sort of thing that I use as a value as I do things is I had an elder one time say to me, "I love what you're doing.
Hmm.
It's needed, but please don't do anything for us without us." And so by that meaning, don't do the typical colonialism approach of tell us what we need,
Hmm.
bring us to the table so that we can contribute to help you understand what we need.
Yep.
And so don't do anything for us without us. And
Hmm.
so I use that as a guiding principle in everything that I do.
Yep.
Having our elders involved in our processes. We've been able to embed traditional knowledge keeping and
Hmm.
traditional healing and traditional medicine approaches to our Western sort of paramedic approach.
Yep.
We've been able to do local capacity building. So working with young people in the community to become community first responders, which are mentored by paramedics, which then they become paramedics and they go to paramedic schools or unis.
Hmm. 100%.
Slightly different than here, but then they go back to their community,
Hmm.
champion and a healthcare leader in their community,
Yeah.
right? So it's about, we're I'm not I try not to think in like weeks and months. I'm thinking in years and generations.
Yeah. Yeah. This type of change doesn't happen overnight. This is a
No,
gradual
no,
change, and the
yeah,
locals know what the locals want. Our experience or our abilities to make things happen is one thing, but it may not be the contextualized or the need that the locals actually need for their evolution or transformation or change. And yet you can't do any of this work without bringing them along for the journey. And quite frankly, you're almost trying to do yourself out of a job. Like to be successful
100%.
in these environments, it's eventually it gets to the point, well, actually, we don't, we've now got, we don't need you anymore. And to me, that's successful. Like in many of the projects
Yeah,
I've worked in similar environments, but not in Canada, it's that my goal is actually to be made redundant.
yeah,
Um,
yeah.
Come back maybe every
We
couple of years and do some auditing and some continued checking and stuff like that and provide advice as needed. But realistically, they've got total control of the train and they're chugging forward.
Yeah, so we
Mm.
call that Duncan in our big umbrella. We
Hmm.
call that health. We call that health transformation, and
Hmm.
then under the big umbrella, we call it devolution of service.
Yep.
So we want to
Cool.
devolve ourselves out of the service provision. So
Hmm.
you're absolutely right. In layman's terms, it's I need to be working myself out of a job every day
Yep.
because I don't want to run the service for this population. I want this population to take ownership and run what they need to serve themselves,
Yep.
right?
Makes
And
it
if I can be
sustainable and it'll grow.
correct,
Mm.
exactly. So yeah, so but again, we still like it's not like we've sometimes I giggle because I shouldn't giggle, but it's like we should have learned by now because of how many years we've done it wrong in the colonial approach, but yet we
Mm.
still do it in certain levels of government and so on and so forth. We still seem to approach things sometimes with the attitude of, I know what's best for you. Let me tell you what is best for you instead of, talk to me, tell me your story, and build the trust, to build the respect, and then and the rest will fall into place. And I would argue that that's a good approach for us as clinicians in any context, right? Like,
Mm.
like we need to listen to our patients. They are part of the journey. Like we often how many groups do we or focus groups do we have out there that nowadays we finally have realized that why are we not involving a patient population, because that's who we're talking about. And so when you look at QA and QI and you look at program development, who should be at the table? Well, yes, we need to be at the table, but the population that we're serving need to be at the table. They need to have a voice. They need to share their lived experiences so that we can be part of that solution based approach. And
Mm.
so whether you're a paramedic in Brisbane or Melbourne or Perth or Darwin or here in Ottawa, Ontario, in Canada, like at the end of the day, it's about the patient and that community you serve. And we have this. I loved in our preamble before you were recording. You talked about we need to realizing our backyard is bigger than our backyard, right?
Mm.
Like, you know, the world is bigger than our backyard.
Yeah.
And so, you know, a lot of people ask me, why do I spend so much time traveling internationally and spending time with guys like yourself, or, you know, other, you know, really great leaders in Australia, like guys like Buck Reed and, you know, and some other friends of mine there, or, you know, my friends in the UK with Andy Collin, who, you know, he hates when I say this, but, you know, he wrote the textbook on independent prescribing for paramedics. And, you know, like there's so many, and there's so many, Nick Nudell in the US, like there's so many incredible leaders out there. And I spend a lot of time with them. And really the big reasons are, my father always used to tell me, much like the saying goes, you are what you eat. Well, you are the people you spend your time with. So if you spend your time with very high flying people that have high functional abilities, then you by default will become that way, and you will think that way.
Mm.
You know, and I surround myself with people who are way smarter than me. You know, that's, you know, when I hire people, I hire people for my weaknesses, because I know I have weaknesses, and I'll admit I have lots of weaknesses,
Mm.
but I need to fill them, you know, with. And so I spend a lot of time working with the international population, because I realize that the system problems or the issues I have from a clinical practice perspective, from a policy perspective, from a legislation perspective, they're not unique to Canada.
Mm.
You have them there. Our friends in New Zealand have them. Our friends in Japan have them. Our friends in Germany have them. You know, you know, I was at a conference in Sweden a month ago, and I met these two lovely human beings from Singapore,
Mm-hmm.
and, you know, and they were telling me stories, and I was laughing, because I was like, we have the same issue,
Yeah.
and and that was Singapore. So,
Yeah.
you know, we need to realize that our practice is bigger than our backyard.
Yeah.
And I loved when you said that, because it is so true,
Mm.
and it's what motivates me.
And I think reflecting back on something you said earlier, sort of this is like your second career, where with your growing up as a 13-year-old with your dad talking about business and all the different approaches like that. I mean, that's with what you're doing now, like that has stayed with you the whole way through. Like, yes, I hate it when people say paramedicine or healthcare isn't a business. Well, it is a business, and it's quite a big business, and if done correctly, can be quite successful.
Yep.
And just like any business, if you just ignore it, or you don't follow the advice of others, or you don't follow international best practice, or whatever flavor you want to put for your improvement approach, then you're not going to be successful. But if you follow basic business principles, I think that that's where you can see the programs or the areas that have been successful when they look at it as a business, moving forward. Because yeah, it is, healthcare is bigger than just the delivering and treating our patients.
Yeah.
Excellent. Well, before we sum up, this has been awesome. I'm sure we could talk for ages.
100%.
IRCP, August 18, 19, Adelaide, Australia. Will we see you there?
1000%. My flights are booked. I am flying from Ottawa, Ontario to Vancouver, Vancouver to Brisbane, Brisbane to Adelaide. So, and I'll be there for both the IRCP
Yep.
and the CAA conference.
Mm-hmm.
I will be speaking at both of them.
Okay, that was one of my other questions.
Yeah, and if any of, I mean, I know I'll see you for sure.
Mm-hmm.
But if there's any of, you know, any of your listeners that are going to be in attendance, then please, by all means, come and stick your hand out and introduce yourself. And you know, I'd love to get to know you and understand your background and sharing your experiences. You know, I just love our international paramedic family. You know, like I
It is
constantly
great.
July
Mhm.
yeah, July 8th every year with International Paramedics Day. It makes me excited, because we are one big international family, and so I just love meeting people. So please, if any of your listeners are at IRCP or CAA, if you see me, please come and say hello. I 100% promise I won't bite. But no, I'd love to meet you, and you know, I'm looking forward to seeing a bunch of my Australian friends and family that are there. Like, you know, like I'm really excited that Ange Martin's going to be there from Tassie, right? Like Ange is, you know, in my opinion,
Some
you
great
know,
things.
she came to Canada and the county I ran for many years ago, before she was a community paramedic, to understand what we're doing. And, so now to see her in that leadership role with Ambulance Tasmania, and, and the list goes on. And then you get like I'm not going to say the old guys, because they would get really mad at me, but you get the foundational people, like the guys like Dr. Peter O'Meara.
Yep.
And then,
Australia's first
guys,
PhD.
Right, exactly. You get guys, and Peter will be there. He sits on the advisory council and board of IRCP, and then so I'm really excited about being in Australia. And if any of your listeners are there, please come see me.
Excellent. Cool. Well, next time you see JD, it'll be very early in the morning where he lives, and it'll be our evening. So he'll be starting his day and we'll be winding ours down. Whether or not the two of us remember to wear the same clothes, so it looks like it seamlessly transitions, we'll worry about that in a few weeks' time. There's been a couple of meetings where we have with guests, but most of the time we then go, oh, that's right, we're wearing something different. Oh well, but yeah, and that'll give a chance for everyone that's listening to be able to sort of ask JD any questions you might have prior to IRCP and other things like that. But JD, thanks for joining us today, and I look forward to catching up with you face to face in Adelaide. I think 17th is our welcome dinner for IRCP, and then we've got the conference over 18 and 19. So looking forward to it. It's always a great conference, and we will see you there.
Absolutely. Look forward to it.
All right. That has been another Australian Institute of Paramedic Practitioners webinar and podcast. Currently, we have a 25% discount for all membership levels for new and renewing members. Use code AIPP2025 to get your 20% discount now. Don't forget to hit the subscribe button and the like button to be alerted to any new webinars and podcasts we've got coming up. Thanks again for listening. Bye for now.